Welcome back to EdLab. Heart disease remains the leading cause of death for both women and men over age 45, according to the Centers for Disease Control. So when it comes to reducing cardiovascular disease, what matters most? Body mass index or fitness level? EdLab is a podcast of the University of Virginia School of Education and Human Development, where we talk to the people behind the school's transformative research, innovative teaching, and thriving partnerships. And in each episode, we aim to demystify some of the big questions being asked in education, policy, health, and human services. I'm your host, Audrey Breen. Today, I am thrilled to be speaking with cardiovascular exercise physiologist Siddhartha Angadi, an associate professor in our kinesiology department. Sid's work for years has examined the role of exercise in reducing cardiovascular disease. In a recent study, Sid and his colleagues found once again how powerful fitness is for our heart health. And if being fit brings to mind something along the lines of a marathon runner for you, you may be surprised to learn just how the researchers measure fitness and what that means for us non-marathon runners. Welcome to the podcast, Sid.
Thank you. Thanks for having me.
So we've been starting these conversations off with a question about sort of your journey. You are now, on faculty here doing a lot of research and teaching here at the UVA School of Education and Human Development. Tell us a little bit about how you got here.
So, it all began in a galaxy far, far away. Wait, no, wrong story.
I do like that story, though.
It started on a continent far, far away. I was in India, and I was working in cardiac rehabilitation. And at the time, I was obviously working to get patients that have had heart attacks, cardiac procedures, and so on, getting them to exercise to improve their health. And at the time, of course, we were looking at not only exercise capacity, but a lot of these individuals tended to be overweight or obese. Mm-hmm. And we were trying to say, okay, can we get them to lose weight? This is back when I was thinking about the more traditional way of getting people to lose weight, move more, eat less kind of a deal. And we quickly started realizing that the results are really inconsistent, heterogeneous, and unpredictable. And at the time, I read a book called Big Fat Lies by Professor Glenn Gazer, who was a professor here at UVA.
Yep.
And so we started corresponding, and one thing led to another, and I ended up coming here to work with him for a PhD. And 17 years later, we're still working together.
That's
We've been collaborating for a long time, written jillions of papers together. And, for I think about 13 of those 17 years, we basically had a standing lunch date for 5 days a week.
Yes, until he moved out west. Now he's out in Arizona.
So I started my PhD here, but then I finished up the rest, did all my patient recruitment and testing and all that at the Mayo Clinic at Scottsdale.
Yep.
And then I was out as a postdoctoral scholar at the University of California in Los Angeles.
Okay.
And then I came back to the Arizona group and was a faculty member there. And in 2019, there was a job advertised at the University of Virginia. And I said, that'd be perfect. And so I applied to it. I actually interviewed in January of 2020 when there was talk of a respiratory virus in China.
Yeah.
And, and the rest is history.
Oh, my goodness. Well, I'm glad you made it here through all of that. That was a challenging time to make a transition, but I'm very glad you're here. Before we get started, I mentioned as I introduced you that your work is in cardiovascular exercise physiology. Can you just give us sort of an overview of what that means? What does it mean to be a cardiovascular exercise physiologist?
It's a lot of long multisyllabic words. But really, so physiology is the study of life. Exercise is basically the study of life at a high metabolic rate. And exercise is a natural stressor. It is one that our bodies have been honed to perform by millions of years of evolution.
Yeah.
And so when you look at the cellular responses to exercise and then scale them up to organ and organ system level responses to exercise and then see how that affects the health of the whole organism,
right?
That's really exercise physiology. And so the other thing to also keep in mind is that when you use exercise, it can be both therapeutic. So exercise does things to your heart, it does things to your lungs and your muscle that actually changes disease trajectories. But also, exercise is a powerful diagnostic tool, because a lot of diseases that don't have symptoms at rest will present with symptoms during exercise.
Yes.
Classic, you have an individual that feels fine at rest, goes out for a walk, now they get chest pain, but they sit down, the pain goes away. The first thing the cardiologist or physician is going to recommend is let's do an exercise stress test.
Yes, see what happens.
And see what happens. So you try to provoke a problem so you can see that happening, and then you isolate the problem, and then you move down that diagnostic and treatment pathway.
Yeah.
So really, exercise physiology is the study of how exercise modifies the business of life, and how you can apply it both therapeutically to modify disease processes, but also use it diagnostically to try and understand if someone has disease in the first place.
Got it. And I know you have multiple tracks of work that you're currently doing. We're going to hone this conversation around one of them. And part of it is because you had another recent paper in the work. So this paper is really about, it's a study of studies, a meta-analysis. Before we get into what sort of the snapshot of time that this paper takes, can you lead us up to kind of what it was this really, I guess, goes back to even Professor Gazer's original book, and the 17 years you all have been engaging in this work together. So kind of take us back and then bring us to this point, and we'll talk about what this paper specifically you found.
Sure. So, let's go all the way back. And what I mean by that is, so in the late 70s, early 80s, people started talking about the obesity epidemic. Right. And folks had been trying to get people to lose weight. And pretty early on in the 90s, we started realizing that weight is a strongly genetic characteristic, and that's one of the main reasons why weight loss failures are so common. It's a biological phenomenon. It's got nothing to do with willpower, really.
Yeah.
And at that time, in the mid-90s, Dr. Stephen Blair, who sadly passed away last year, came out with this groundbreaking paper. And this was based on analyses from the Aerobic Center Longitudinal Study, which was based out of the Cooper Clinic in Texas.
Okay.
And what they did there was they had individuals that would come in to get a health check. Yeah. And as part of the health check, they would get their blood drawn, get their blood pressure, they would get their height and weight, they would get body composition. But what was really interesting was they would also put them on a treadmill and see what their aerobic fitness was. So based on that, they could estimate their VO2 peak or their VO2 max.
Yep.
And when they cross-stratified people based on fitness or fatness, now fatness by BMI would be the BMI categories of normal weight, overweight, and obese. So if your BMI is between 18.5 and 24.9, your normal weight, 25 to 29.9 is overweight, and above 30 is obese. So they stratified people by that. But they also cross-stratified them by fitness. So if you got out of the bottom 20th percentile of treadmill time...
This is part of my favorite part of this work.
Right.
Can we talk, before we get to that the 20%, 80%, explain to us what VO2 max... I mean, I understand that it's a measure of oxygen, but why is that a measure of fitness? Yeah,
so VO2 max stands for nothing but maximal rate of oxygen consumption. And physiologically, it is nothing but the product of how much oxygen your heart and lungs can put out. So that's cardiac output.
Yep.
And how much can your muscles that are exercising extract at the same time. And so it is nothing but the measure of your maximal aerobic capacity.
Okay. So let's get into this 20%.
Right.
I'm like rubbing my hands together. I'm excited about it.
And so what they showed in that classic paper was that once you got out of the bottom 20th percentile of fitness, effectively BMI lost all predictive power for predicting the risk of death. Now, since then, many, many papers have come out that have fairly consistently replicated those findings. And importantly, one of the things we realized was, of course, back in the day when they did the Aerobic Center Longitudinal Study, all of the participants in that study were male. And the last time this meta-analysis happened, it still had a fair bit of overrepresentation of the Aerobic Center Longitudinal Study cohorts. Nothing wrong with that per se. It just was predominantly male. And, that's not what humanity is.
Yes, right.
And when the last meta-analysis came out, only 10% of the population in that meta-analysis was female. So when we looked at that, of course, this raises the question, are these results generalizable, right?
Right.
And so when we took a look, we said, okay, now there have been many more studies done in many more countries.
That brings us up to recent paper.
To present day.
Okay.
And so when we pooled all the data together, so what you do is called a meta-analysis and a systematic review. And a meta-analysis is nothing but a study of studies. So you take every single study that has looked at this question of fitness versus fatness.
Got it.
You do a full literature review, literature search, and then you have two people that independently come up with the studies they would like to include and what data they would like to extract. They have to agree on this. If not, then you have to have a tiebreaker.
Right, okay.
And then once you have all the data in, send it off to the statistician, you run the numbers, and then you can get at this question of, well, what is more important? Is it more important to be of normal weight, or is it more important to be just a little fit?
And you found?
And what we found, drum roll, is we essentially found that once you're just a little fit, like I said,
out of the
bottom 20th percentile, the majority of the studies said that if you got out of the bottom 20th percentile of fitness, you're considered fit. Some of the very few studies said bottom third or bottom 50th, but still that's incredibly generous. We're not talking about people that need to start training to run marathons.
Right. These are not elite athletes.
Not even close.
Okay.
And so we looked at that, and we looked at the ability of fitness or BMI to predict the risk of death from all causes. So that's all-cause mortality.
Yep.
And CVD mortality, so cardiovascular disease mortality, which is death from strokes, heart attacks, heart failure, and so on. And what we found was if you're obese and fit, your risk of death was roughly half of that of someone that was normal weight and unfit.
Wow.
And once you factor in fitness, basically BMI largely lost predictive power, whether it came from all-cause mortality or looking at predictive power for cardiovascular disease mortality.
Wow.
And it was far worse to be unfit than it was to, be a certain weight category.
So we are still spending a lot of time on weight loss. Can you talk a little bit about how we think about that and how it relates to this conversation about this value of exercise and movement?
Yeah. So if you look at body weight and weight loss, if you ask the average influencer, they're going to be like, yeah, this one weird trick is going to help you lose all the pounds,
we've
right?
We've all seen those, yes.
Whereas in the real world, and what I mean by that is from a research perspective, in the early 90s, there were studies coming out that looked at heritability or body weight responses in twins. And what rapidly became apparent, and these were incredibly well done studies. So, for example, they did a study in which they had monozygotic, so genetically identical twins that were effectively locked up in a metabolic ward for 115 days at a time.
Oh my gosh.
For the first 15 days, they fed them the same number of calories to figure out how much they need to feed them to maintain body weight. And then off the remainder of the days, on 9 out of 10 days, they made them exercise 1,000 calories a day.
Good heavens.
Right? And this is supervised. So
sure.
Yeah. And so they know all the calories going in. They know all the calories coming out.
Yep.
And at the end of the study period, you had some twins, and these poor people lost like a pound.
Oh my God.
And then there were some twins that basically lost about 18 or 19 pounds. But the beauty of the experiment was because your other twin was also in the study at the same time, they could ask the question, what predicted your weight loss the best? Was it the weight of all the other people in the study? That's the environment. Or the weight of your twin in this study?
Yes.
And basically, genetics predicted weight loss 6.8 times better than the environment.
Wow.
In fact, the heritability of body weight is equivalent to that of height.
Really?
Right. And so what that results in then is that you've got these incredibly powerful physiological adaptations that occur when people lose weight. So your metabolism slows down. So if you have a 150-pound person that has lost weight and arrived at 150 pounds versus a 150-pound person that has always been at 150 pounds, the first person, their metabolic rate is actually going to be a lot slower.
No kidding.
And then the other thing that happens when you lose weight is that the hormones that tell you to eat, like your hunger hormones like ghrelin, and the hormones that tell you to stop eating, like your satiety hormones, they effectively conspire against you to keep you hungrier all the time and make you feel less full all the time.
Oh, wow.
So your biology conspires against you to make you regain all that weight. And in fact, when you look at meta-analyses of weight loss studies, the recidivism rate of weight loss is basically 100% at 5 to 10 years. Now, this is with diet and exercise, not with bariatric surgery the new weight loss medications.
Right.
So, that's the problem.
Right.
And so you then can end up in this futile sort of weight loss cycle where you then yo-yo. And the problem with yo-yo dieting is it increases the risk of the same things that are associated with increased body weight, cardiovascular disease and cancer, for instance. So that's not good. So this is something that Glenn and I had proposed in our paper in 2021, which is think about exercise as a way to break out of that futile weight loss cycle and focus on exercise as a means to improving your cardiac function, your pulmonary function, your lungs, basically, and your muscle function, rather than thinking of it simply as a means to losing calories.
Yeah. And so we have this really helpful meta in this paper that is showing the positive benefits of movement and exercise. So let's say we're not in the top 80%, or we find ourselves in the 20th percentile, or we just want to make sure, maybe we are, but we're not really sure. What does it look like to be fit according to this sort of calculation?
So remember, the most important thing when it comes to exercise and movement is doing just a little gives you the most bang for your buck. Now, I'm not saying if you like running 10Ks, marathons, whatever, go for it. No problem.
Yes.
All right. You'll get a marginally improved outcome, life-wise when you do those things. But when you go from doing absolutely nothing to just doing something, you drop your risk by about 50%. Now, what does this something look like? I recommend just following the American College of Sports Medicine guidelines on this. It's 150 minutes of moderate intensity activity in a week. Moderate intensity activity can just be a brisk walk.
Great. I was just going to ask.
Basically getting up to an intensity that makes it somewhat hard to maintain a conversation.
Got it.
While you're walking around or jogging, what have you.
Yep.
Or you could do vigorous activity. And if you're doing vigorous activity, you can get away with doing even less because then you only need 75 minutes a week of vigorous intensity activity. And if you can lift weights twice a week, that's great too. You should, whenever possible, do that. And that's good enough.
Yeah. One of the things we talk about on the podcast a lot, and the work that's being done at the school is really diverse, but I think one of the really critical threads, and you've already mentioned, your longstanding collaboration with Professor Gazer, is how none of this work happens in isolation. What role do partnerships and partners play in getting this kind of work done? Well,
so, if you think about, I've been working with Glenn now for 17 years. In fact, his book is what got me to think about weight differently, right? And of course, physiology lines up with it now. But then you've got another one of my co-authors like Craig Patterson, and he's at the University of Bristol. He's fantastic in terms of meta-analyses and meta-analyses related methodologies. So he's really the man, so to speak, when it comes to figuring out the ideal statistical models and how to use them appropriately in these complicated analyses. But then you also have the first two authors of the paper. One's Nate Wheeldryer, who's a current PhD student with me, and Jason Guzman, because nothing happens without the students, because they're really the folks doing the day-to-day heavy lifting of collating all that data, putting it in one place, making sense of it so that we can then work off it. And so, nothing happens in isolation. Nothing I can do can be done by me alone.
Okay, let's pretend we are 10 years in the future. What do you hope that we know in 10 years that you don't know now?
Yeah, so a couple things. We've done a number of studies now that have looked at exercise and its ability to reduce the risk of bad outcomes. So, for instance, there was a study in the early aughts which compared exercise to stenting in people with cardiovascular disease, specifically coronary artery disease. And exercise worked out phenomenally well in comparison to that therapy.
Wow.
Of course, this precedes the drug-eluting stent era, so that needs to be replicated again.
Right. Yep.
You had the HF Action trial, which looked at exercise in heart failure and showed that when you get folks to exercise when they have heart failure, it reduces their risk of death.
Wow.
That was terrific. And then on the diabetes side, in fact, what I'd really like to see is something like the Look Ahead trial, but with exercise.
Yeah.
So Look Ahead was a big trial that unfortunately had to be shut down for futility, because what they did in this study was they recruited a bunch of people with diabetes, got them to lose weight, but they did not die less at
yeah.
They did not die at a lower rate.
Got it.
Mortality rates were essentially the same. But when they did some post hoc after the fact analyses, what they found was that the weight loss, even in this cohort, did not predict risk of death. Change in fitness did.
Oh, wow.
And that was published a couple of years later.
Yeah.
So what I'd like to see is something like that, where you focus on exercise as the primary intervention in the absence of weight loss, and trying to see if that reduces mortality, for instance, in these patients. And in fact, there are already data that are leading us that way anyway.
Mm-hmm.
So in the early aughts, there was a diabetes prevention program that showed a lifestyle program reduced the risk of transitioning from pre-diabetes to diabetes by 52%. But I think one of the most underrated and underappreciated factoids from that study was that the majority of people could meet their physical activity recommendations, but only about a third met their weight loss goals.
Oh, interesting.
So again, getting at let's just focus on the exercise. Let's not worry about the weight.
Fitness first. Yes.
Like a fitness-focused intervention, and run that randomized control trial. Because let's face it, one of the limitations of our current work is that it's still based on epidemiological studies. So it's not the highest level of evidence, which is a randomized control trial. So to run that RCT would give us the greatest amount of clarity on this question.
Yeah. In the meantime, we just need to get up and move a little bit, right?
Yeah, just a little bit. It's not a lot. I'm not saying don't do more exercise if you don't like it.
Yeah.
But, I think one of the worst things that exists in popular culture is the whole no pain, no gain business, right?
Yeah.
You don't need to kill yourself, is what I'm getting at.
Yes. I appreciate you saying that. Yeah.
The greatest bang for your buck is when you just do a little bit.
Yeah, that is so great. Well, I know you've got other work coming, other grants in the pipeline, so I really hope you will come back and we'll talk about those next. How about that?
It's always fun. Thank you.
Thank you so much.
Thank you.
EdLab is a production of the University of Virginia School of Education and Human Development and WTJU 91.1 FM. EdLab is produced by Audrey Breen with support from Mary Garner McGee and Sage Tongwe. Our music is Palms Down by Blue Dot Sessions. You can subscribe to EdLab wherever you listen to your favorite podcasts.